Good evening, everyone, and welcome to another live. Can you believe that it's almost the end of the year? So happy holidays. And to those of you that are listening on the replay, again, I wish you a very happy holidays and a very Merry Christmas. So many of my topics come from real time um, questions that come into the medical boards. And I sit on a couple of medical boards. I've mentioned this in earlier videos. I do sit on the ANDI Diving and Hyperbaric Medical Board, and I do sit on the medical board of the International Hyperbaric Medical Foundation. And it's interesting that for everything that we know about hyperbaric oxygen therapy, there is still just so much that isn't used. And that brings me to my topic tonight. So again, let me introduce myself. My name is Laura Betts. I'm founder and facility director here of HyperbaricsRx. And I do these informational topics every week to give you some information and be able to apply hyperbaric oxygen therapy to improve your health, improve your life, improve your outcomes. And neuropathy is a absolutely debilitating symptom. And it is a symptom. It often is used as a diagnosis, but it's not a diagnosis, it's a symptom. And neuropathy it's an interesting thing because in wound care, hyperbaric is covered for certain kinds of wounds, but it's not covered for neuropathy. Now, it just so happens that when you heal the wounds, very often there is some benefit to the neuropathy symptoms. But tonight I'd like to talk about neuropathy specifically. And if you're struggling with neuropathy, if you know someone who is dealing with peripheral neuropathy, it is painful, it is debilitating, it's pain, it's numbness, it's tingling, it's weakness. Usually it presents in the feet, but it can present in hands and other extremities as well. And it is really challenging because now the things that we would need to do, the lifestyle changes, the exercise, the interventions, in order to create an opportunity to address some of the root causes of what's causing the neuropathy, of why the neuropathy is there. Well, by the time very often people are motivated enough to make a change, they're in so much pain that they're not able to make a change. So it's a very common problem, and this is one of the reasons where HyperbaricsRx shines, because in most cases, people can lay there and breathe and watch a television show. And again, we work with neuropathy here. We see this at the clinic all the time. Now, again, I mentioned that hyperbaric is covered by insurance for wounds, but very often it's not covered for neuropathy. So as a result, people are left to struggle, and the interventions for neuropathy very often are worse than the neuropathy itself. So one of the common drugs that's prescribed for neuropathy is something called gabapentin. And while gabapentin does have some pain management benefits, the mechanism of action of gabapentin interrupts neurogenesis. So essentially, what's going on with neuropathy is the nerves are dying and they're sending out warning signals. They're going, help me, help me, help me. The neuropathy itself is a symptom that there's something wrong. And a lot of the interventions just create the opportunity for the nerve to die more. There are therapies where they burn the nerves. Well, again, that may temporarily address the issue, but the fact that the body is not able to make new nerve cells, that the natural healing mechanisms, right? The body can heal itself. When you cut your hand, it's supposed to be able to heal. So what's going on with these extremities? So I want to do a deep dive into neuropathy and talk specifically. Now, again, in the root cause of neuropathy, there is an oxygen insufficiency. So what does that mean? The tissues don't have enough oxygen. Nerves themselves are very poorly profused. They don't have a lot of oxygen supply to begin with. If you think about muscle, muscle is red. If you think about nerves, nerves are more yellow-white. So less blood supply. So less blood supply, less oxygen, slower healing. In fact, the lower the amount of oxygen in a tissue, the slower the tissue heals. And in some cases, it's very challenging for that tissue to heal once that oxygen supply has been interrupted. Now, hyperbaric, it restores the oxygen pretty quick, single hyperbaric session. But because nerves are slow healing, usually you need a fair amount of hyperbaric sessions in order to get some full resolution. So in general neuropathy protocols, minimum of 10, but more likely 20. And if the neuropathy has persisted for a while or the underlying root causes aren't being properly addressed, the course of hyperbaric could be 40, even maybe more than that. So sometimes it's called peripheral neuropathy. It's regarded as nerve damage. And again, in order to heal the tissue, in order to heal the wounds, we need oxygen. But once the tissue is damaged, we end up with this cycle that can't be broken because it needs oxygen for it to heal, and it can't get oxygen to the area because it's damaged. So again, this is where hyperbaric really shines. Now, another neat thing, one of the mechanisms of hyperbaric is it reduces inflammation. And one of the less known sub-mechanisms is hyperbaric actually downregulates the neurotransmitter associated with our pain receptors. So hyperbaric, from a pain management point of view, it's clinically documented to reduce pain, to shift the pain tolerance for about 14 to 21 days after a single hyperbaric session. So how cool is that? We're healing the nerve, we're creating the opportunity for neurogenesis, we're bringing down inflammation, which has an analgesic benefit in itself. It reduces pain. When we bring down the inflammation, it creates an opportunity for the body to get more oxygen to the area, so we get accelerated healing, and we get a separate sub-mechanism that allows for a reduction of pain. There is a pain management aspect in how hyperbaric is affecting the pain receptors, how it's affecting the neurotransmitters. So it's very, very cool. And again, because it can overcome the oxygen insufficiency, these things that are regarded as unhealable can suddenly be healed. Again, the common interventions is to kill the nerves. Okay, but what about the rest of the nerves? Why did these nerves die in the first place? So again, creating an opportunity um, to not just put a Band-Aid on it to do some pain management, but actually create an opportunity for some healing. Now, some of the common symptoms, again, and this is identifying with you, you need to reach out and do a consult with us. Pain, burning, it can be sharp, it can be shooting, it can be stabbing sensations, numbness, loss of feeling, inability for touch, temperature, or even pain. Again, the nerve itself is not working properly. The nerve itself is compromised and potentially dying. Tingling pain, pins and needles are very, very common sensation. Obviously, if the nerves aren't working properly, we can get weakness. And this, when cases of when it's happening in the lower extremities, it can cause coordination issues, it can cause gait issues, it can cause balance problems. And it's not going to get any better unless we address the underlying root causes of why it's happening in the first place. Now, again, there's a lot of different reasons why neuropathy can happen. And typically, neuropathy is a symptom of an underlying root cause. Now, some of those symptoms can be an injury, some kind of damage to the nerve ending, and now the nerves are trying to heal, repair, and they need some help, which hyperbaric does a really good job there. So like an accident, like an injury, this can happen from a surgical procedure. But one of the other things that this is very common from, and a very underlooked root cause, is toxin exposure. So a lot of people walk barefoot, and they're walking barefoot over cleaning chemicals. They're walking barefoot. Just because you're walking on a nice manicured lawn doesn't mean that you're not getting exposed to pesticides. And many of these pesticides use a heavy metal component to it. We've done lots of cases here where when we take a complete medical history, we find out that they had a type of occupation where they had pesticide exposure. One of our clients owned apartment buildings, and he used to do the exterminating himself. And he used to spray the pesticide. And down here in South Florida, he's wearing sandals while he's doing this. So we can actually pull a tox panel. We also use a really cool non-invasive technique, a form of applied kinesiology called quantum nutrition testing. And just like we can hit your knee and get reflex on your knee, very often we can get your nervous system to tell us other things that are going on there. So it's a pretty neat tool here. So in this case, we ran a tox panel, and the tox panel came back with glyphosate and atrazine and a whole bunch of other pesticides. Well, these pesticides are neurotoxins. They cause nerve damage. So in this particular case, and a very common overlooked root cause is toxicity. Now, cleaning chemicals, many of these cleaning chemicals can cause this. You can have where they've done some kind of construction and the leftover construction materials can leach. We live in a very, very toxic world. Now, obviously, diet, nutrition does play a big role here. And the body, while oxygen's the primary component, it's not the only component. So a lot of times when you pair lack of circulation, dietary inflammation, ultimately it presents first in the extremities. They're the furthest away from the heart. They have the least oxygen supply. They also are more likely to have mitochondria damage than other areas of the body. So they're more susceptible to injury. And this is a common reason why neuropathy is present. So surprise, surprise, you can do hyperbaric oxygen therapy to create neurogenesis, to actually repair the nerves instead of just killing them. And we can do some targeted detox to address the root cause of, let's just say, chemicals, pesticide. And of course, we can do targeted supplementation to quickly address the nutritional deficiencies and get the body healing. Another issue is people do not have enough essential fatty acids in their diet. So again, the primary components that the body needs to make the nerves, we're always in a regenerative cycle. Our cells are always dying, and our body, assumingly things are working right, is making new cells. So in order to do that, oxygen is the big ingredient in the cake, but it's not the only ingredient in the cake. And if we've got environmental toxins that are interfering in the neurogenesis, that are preventing the mitochondria, the engines in the cell, from being able to run and do their job, it makes for this chronic condition. And again, neuropathy is a symptom. Now, another overlooked root cause that we see here all the time is a pathogen. Now, a lot of people may be aware that shingles, for example, can cause neuropathy, but so can HIV, so can Lyme disease, so can hepatitis, so can these complex pleomorphic pathogens. We've got these superbugs all over the place. And again, maybe in this case, the neuropathy is being caused by a critter that's affecting the area. Now, again, this is another area where hyperbaric oxygen therapy shines. Hyperbaric is a broad spectrum bactericide. And unlike an antibiotic, the hyperbaric only kills the bad stuff. It doesn't kill the good stuff. So the good gut bacteria, our immune system is in our gut. These things are neutrals undergoing hyperbaric, but the bad stuff and the oxygen is able to get into those poorly perfused areas that would be very difficult to treat in other ways. So one of the coolest things about hyperbaric is the oxygen is going everywhere and it gives the body what it needs. And if there is an infection there, if there is a pathogen, even if it hasn't been diagnosed, the body knows that it's there and it's going to address it. Now, again, another cool thing about HBOT, when it's done properly at an ANDI certified hyperbaric facility, like HyperbaricsRx down here in South Florida, it's very safe. It's non-invasive. It doesn't have any side effects. So it's only going to do good things. It's only going to create an opportunity for improvement. And one of the things that we recommend if you're dealing with neuropathy is that you schedule a comprehensive consultation. Let's take a full medical history. Let's go ahead and do a non-invasive organ and gland scan using reflex and see what your body comes back with. And if necessary, let's run a tox panel and see what we're dealing with there. Lots of people have heavy metals that contribute to the neuropathy. Lots of people have high levels of pesticides that contribute to the neuropathy. We've got a lot of environmental chemicals that we are exposed to, like cleaning chemicals, even certain topical foot medications are actually quite toxic. So you're trying to address one problem and you're creating neuropathy symptoms while because of the toxicity in the ointment, cream, and so on. So this is one of the things that we do here. So if you're struggling with neuropathy and they're telling you that there's nothing you can do about it, they're giving you medication for the rest of your life, they're talking about a therapy that's just going to completely burn the nerves away. Meanwhile, it's affecting your quality of life. You're in pain. You can't sleep. Please reach out to us at the office because we work with these cases all the time and we really can help. Now, our videos are archived on our YouTube channel, which is HyperbaricsRx. So if you'd like to send this video to somebody that's struggling with neuropathy, you can go ahead and find that there. And I do want to mention that HyperbaricsRx, we are one of the oldest and most experienced facilities in South Florida. We were founded in 1999. There are very few facilities that have as much experience and as much success working with these complex chronic conditions. I pioneered something called foundational medicine. We are an ANDI training and research site, and we are the only holistic hyperbaric center of its kind. So optimally, what we want to do is a comprehensive consult. We want to take a full medical history. We want to figure out what's going on. And more importantly, we want to put together a personalized program that includes hyperbaric oxygen therapy, diet lifestyle changes, as well as targeted supplementation with potentially targeted detoxification in order to fully address the underlying root causes here and get you feeling better. Now, again, hyperbaric is going to start to treat the symptoms right away while creating the opportunity for the body to heal, detox, and repair. The root of all disease is ultimately some kind of lack of oxygen that's resulted in mitochondria damage or some kind of mitochondria damage that's resulting in lack of oxygen. The body cannot heal, detox, or repair without oxygen. It is the primary component in just about everything that our body does. Now, again, I said hello before, but I am founder and facility director of HyperbaricsRx down here in Fort Lauderdale, Florida, and I would love for you to let me help you. Let this year be the last year that you're struggling with these neuropathy symptoms. Let this year be the last year that you're in pain. Please reach out to us. We can help. Even if you've been told there's nothing you can do, guess what? There's always something you can do. We have some of the highest success rate of all of the ANDI research centers. We have cutting edge protocols and cutting edge techniques to get you feeling better. Our number at the office is 954-749-9998. You can send us a direct message. Please let this be the last year that you're struggling. And again, happy holidays, everyone. My name is Laura Betts. I am known as the Oxygen Lady, and I look forward to seeing you again on another one of our videos. Have a wonderful evening. Thanks so much.